I was first talked to my psychiatrist after my diagnosis, they told me I wasn't well enough to qualify for talking treatments, for other treatments, which really confused me, because if I felt I was been diagnosed with severe depression and I didn't meet the criteria for these therapies, but if I'd have had these therapies, I would have cost the NHS a lot less, because I would have got better sooner and I wouldn't have been off work, I wouldn't have had to claim benefits, and I wouldn't have had to be a burden on the system like I was.
But it seems to me sometimes they don't get their priorities right. I mean, they don't have to spend a huge amount of money providing support services if they only targeted them in the correct way.
I initially sought help. I was assessed by the Child and Adolescent Mental Health Services when I was 16. And I was in mental health crisis at the time, and I was told I didn't meet the criteria for their services, and I was discharged from their services. And like you'd said about when you'd had cuts before, like the impact that has on your self-esteem, to essentially be told you're not worth saving, you're not, or particularly some of the things I was saying to them, it was essentially, in my mind, I was like, I'm not worth life, almost. And I think had I been treated at the time, I would not have gone on to have the 2 subsequent hospital admissions, and I may not have gone on to develop the more chronic mental health problems that I have now, had it been sort of treated at its root. And the reason that they told me I didn't meet their criteria was obviously because they have such a strict criteria, because they have such a scarcity of funding.
I think a lot of it comes from how people look at you, and this runs through into how the NHS treats you as well. Because if I talk to somebody and say, I have a heart condition, they're very sympathetic. If I talk to somebody and say, I have cancer, they are incredibly sympathetic. If I talk to somebody and say, I have mental health difficulties, they say, you look fine to me. And if ordinary people are treating people with mental health problems in that way, it's hardly surprising that at funding level, we also feel we are treated the same way as well.
When I was first, when I had a crisis, my first crisis, I rang up what was NHS Direct then, and I spoke to a nurse, perfectly nice nurse, but she turned around and said, well, do you think you can manage till tomorrow? Because I don't really want to call the crisis team out unless I have to. Which is ridiculous, because if you had a physical ailment that was risking your life, like you say, heart attack or stroke or something like that, they wouldn't say to you, well, do you think you can manage till tomorrow? Because I really don't want to have to call the ambulance out.
You just calm the appendix down just for a little bit, you know, just until the early hours.
If you said that to someone, you would be in so much trouble for physical health, but it seems okay to make people with mental health wait because they don't want to spend the money in calling the out-of-hours service out.
I was made really aware of the lack of beds and the lack of space that was available. I was told there are lots of very poorly people on the waiting list. So, you know, you really, you know, you're being given this opportunity, you're very lucky, which is not a term that I would have applied to myself in that current situation at that time. And no one should be made to feel like with a physical health problem, people don't tell you you're lucky to be getting treatment.
It frustrates me so much that they seem to think it's okay to put a price tag on people's lives. And that's what they're doing, because they're saying, well, we won't fund it anymore. How's this going to affect them? And they don't seem to realise that if you don't fund things properly, people will die.